So good afternoon as the clock ticks 12. Welcome wholeheartedly on behalf of Women's Health and Wellbeing Barwon Southwest and Economic Security for Women. I would love to extend a great welcome to you all to be part of today's conversation, looking at women's economic security in the context of COVID-19. My name is Emma Marnie. I'm the CEO of Women's Health and Wellbeing Barwon Southwest. We are a regional women's health promotion organisation. We strive to turn evidence, research into action. We focus on the prevention of violence against women before it occurs. We focus on promoting women's sexual and reproductive health, rights and choice, and advancing the broader gender equity. That's our core business. At the start of the COVID-19 pandemic, we put a call out to women in our region across the Barwon Southwest, so from Geelong to the border, to say how you're going, what's up, and what questions do you have? What are the issues? What's happening at this time? The most resounding call we got was a call to have discussion around money. The challenge of women's experience, the roles that they juggle, the fact that women are commonly in less well paid, less secure work, considering sometimes whole sectors that are predominantly women are paid less. It's a time where, on top of all of that, women are also disproportionately at the front line. So somehow they're holding the front line around childcare, health work, disability, mental health work, education, early years, and doing the double shift with the homeschooling at the same time. So it feels like a really amazing opportunity to have a conversation around women's economic security and experience. And again, I welcome and thank you all for being here. Before I go any further, I would love to acknowledge the traditional custodians of the land on which we meet. So being in Warrnambool today, I'm on peak Barwon country of Eastern Maar Nation. I want to acknowledge the traditional land on which each of you are today. And I want to, with grace and care, acknowledge what's happening internationally at this time. I think the experience in America at this time is difficult to reconcile. And it calls Australians to action around how we make peace with, understand our history, how we live reconciliation, and how we find ways for Aboriginal people's stories, experiences, and the racism that is within our world, and at times, and like today's discussion, within the structures that underpin how our world is organised. So a wholehearted recognition of the traditional custodians on the land on which each of us are today. I wanted to quickly just touch base around how this will work. Like I said, you haven't been able to mill around the cup of tea table and meet some people, and we may not have the opportunity to do intros right across the screen, but we want to make sure that everybody has, so first and foremost, we want to hear from you. We have a panel of great people. I was going to say women, but Stephen, that's not women and men on our panel, with some great dimensions of this discussion around economic security that they can offer. So we want to hear your stories, your questions, your reflections. So what's going to happen is I'm going to facilitate that. What I'm going to ask, and you will have seen this as you come in, that you'll be muted, and most of the time we ask that you keep your microphone on mute. What will happen is I will, if you have a question, I'd ask that you put your hand up, and what I'll do is I'll invite you to speak. And so at that time, it's a good time to unmute your mic. The other important thing before I go further is about recording. So I need to share that we're recording this. So if at any point you have a question or a story or something you want to share that you may not feel comfortable being recorded, you have two options really. You can close the camera, or you could talk to Carly Dennis after the webinar. Her email address has been in all of the communications, and just let her know that you might like that section edited out. Our enormous team of video production, which will likely be Carly and I, will navigate that later. So, as I shared, we'll have a panel presentation. Each panel member will speak for about 10 minutes. At the end of their presentation, you will be invited to ask any questions. So I will facilitate that just so that we make sure that everybody is heard, that we're not speaking over each other. So the 4 panel members will have an opportunity each to go through that, to do their presentation and have some questions. At the end of, excuse me for a second, thank you. At the end of each presentation, the 4 presentations, we're opening up the screen, as it would be, to more questions, anything that you'd like to ask the panelists or anything you want to share at that time. That's going to run through to 1:30. At 1:30, we're going to flip the focus and we're going to move the conversation from 1:30 to 2 over to those on the screen in cyberspace who have their own stories, experiences, questions or reflections. So you are absolutely wholeheartedly invited to continue to direct those questions to the panel, while we want to be really clear that we want to, in a way, privilege and welcome your voice and your experience for that period. So I hope that's clear. Any questions? Anything that you're unsure about? Everyone looks like they can navigate this new technology. Beautiful. So without further ado, I would like to provide a short welcome, the Chair of Economic Security for Women. I'm assuming that we've got you back online. Rosalind Anderson, over to you.
Hi, well, this isn't Rosalind, this is Sharon. Rosalind is there, she waves, she's on the Randy one there. She's having technical difficulties with her microphone, but I'm Economic Security for Women's Finance and Project Officer. And so I'll just give you just a little brief outline that Rosalind was going to give. So we're a national women's alliance funded by the federal government, and we're made up of approximately 26 member organisations and partner organisations. Women's Health and Wellbeing in Barwon Southwest is one of our new member organisations, and today you will hear from Mary Crooks and Julie Kern, both who represent their member organisations on our council, and Stephen Koukoulos, who's our economist in residence. We've been around since 1999. We were incorporated association in 2010. We are one of 6 national women's alliances, and our priorities are gender equity, equality, workforce participation, women's economic security and wellbeing, and women's lifelong economic sustainability. And that has a wide range of workforce participation. How do we get there? How do we, funny how access to childcare, affordable and accessible childcare got women back into the workforce during the pandemic as essential workers. And we look at the paid and unpaid care work. And we have a couple of white papers out there that are all on our website that provide a wealth of information on what impacts women's economic security. And we've gathered that information by speaking to women around Australia, such as women and men, such as we're doing today. Prior to COVID-19, we held these as face-to-face roundtables in Sydney, Brisbane, Gold Coast, Melbourne, Tasmania, in Hobart and Launceston, across in Perth, and Harvey in Western Australia in Adelaide. So not being able to travel at the moment, this is our next option, as to be able to do it today virtually, which is great to see all the faces, and I'm really looking forward to hearing all the discussions, so then we can also take your voices back to Canberra with us when we're amplifying the voices of all women living in Australia today. So that's me.
Beautiful. Well, that's us. Thank you very much, Sharon. And Women's Health and Wellbeing, Barwon Southwest are so thrilled to be partnering with Economic Security for Women for this occasion. So what we're going to do now is we're going to leap into a presentation from one of our 4 panel members. Because of the way this will work today, I might just work through one presentation and one biography at a time rather than introducing the whole panel to start with. You might better see their smiling faces on the screen. So let's begin today's discussion around women's economic security, money in women's lives in the context of COVID-19 with Stephen Koukoulos. So as Sharon shared, Stephen is an economist in residence at the Economic Security for Women. Stephen is an accomplished economist who has even had roles like an economic advisor to the Prime Minister. He's been chief economist in major banks. He's also been critical in writing these white papers that Sharon spoke about that have really beautifully distilled the structural and long-term change we need to make to actually provide more security, more certainty for women's long-term financial well-being. So without further ado, Stephen's going to speak today about COVID-19 and the disproportionate financial stress on women. Over to you, Stephen. Thank you.
Great, thank you very much for that introduction. And yeah, I'll try to distill it into a couple of key points because, of course, what's happening is still unfolding. I think we're only in the early stages of the economic fallout, the financial fallout from the COVID issue. We're in the depths right now, the low point, if you like, of the economic cycle. We're still learning what's happening. But nonetheless, there's been a bit of really important data that's come out to sort of give us some guide about what's happening. So I'm just going to run through some of those issues and then, of course, come up with what we think still needs to be done, COVID or no COVID, although with that, it's actually accelerated perhaps the case for some of those issues. Now, I don't think I've got control of these slides. So if whoever's got control could move to the next one, please.
Thank you, Stephen.
Here we go, lovely. So again, these are just sort of a few little talking points. So just to go through some of the important economic impacts. We know that businesses have closed, activities shut down, many jobs have been lost, and while JobKeeper, JobSeeker sort of keeping a few people attached to the labour market, there's still a sharp increase in the number of people who are going to be unemployed and businesses closed forever. Now, for women, they've been impacted in some different ways. It's interesting that some of the traditional sort of values that have been placed on women are seemingly showing up in the data. Again, we probably need a couple more months' numbers to be sure, but it seems though that women have taken the responsibility for one reason or another to do the homeschooling, to do the caring, as this COVID's forced us to stay at home. And that's, as I said, I'll show some numbers in a moment to show how that's happened. And that's even though women have suffered more job losses than men. However, the curious thing about this is that the level of wages earned by women has fallen less than men. And I'll explain that in just a moment. So the next slide, please. Here's one aspect of that working 0 hours. You may hear from time to time how people complain about how the Bureau of Statistics calculate the unemployment rate. And people are counted as working even if they work 0 hours, or some people are counted as working if they work 0 hours. And that could be because they're on sick leave, they're on long service leave. So you've still got your job, but you just haven't worked any hours in that particular month. This chart goes back to 2015, and you can see there that for men and women, there's about 25,000 people per month who are employed but doing 0 hours. And the numbers are broadly similar between men and women over that period of time. Look at the first couple of months of data we've got with COVID. The number of females working 0 hours has shot up to just under 450,000 people. Men, it only shot up to just above 340,000. So while we're seeing people move to the job seeker issue, and this is sort of partly an economic argument, but it's also importantly a gender issue, that more women have decided or been forced to go down that path of maintaining their job but working 0 hours. That, as I mentioned, could be linked to the childcare and other caring issues that are there. So again, it's just a sign that perhaps it's that traditional, I hate the term, but the traditional values are coming through in how that change in the labour force is occurring. And of course, if you're working 0 hours, you're earning $0 unless you're lucky enough to get the JobKeeper payment. Next slide, please. Again, this chart just shows the proportion of those employed who are working 0 hours. And interestingly, right back to the year 2000, this is sort of April data going back 20 years, women, a higher proportion of women in the workforce are working 0 hours. You can see that it tends to hover around about 8, 9, 10, 11%. And for men, it's around about 5, 6, 7%. So again, there's that skewing there that's been evident right through our last 20 years. But look at the most recent numbers for April. 18% of women in the labour force in employment are working 0 hours. For men, it's jumped up to just above 11%. But again, that disproportionate impact on who is working 0 hours is very much skewed against women. Next slide, please. Now, this is a really interesting, quirky thing. We were going through the numbers, because what we do know is from the Bureau of Stats again, the change in payroll numbers. So this is from the tax office data about when we pay our PAYG tax, or each fortnight, I think it is. And what you can see where the two big arrows are pointing down, that's what I want you to focus on. So you can see the change in payroll employment between the 14th of March and the 2nd of May. Unfortunately, that's the latest data. I think next week we get the next update on that. And you can see that male employment fell by 6.9%, female fell by 7.1%. So a few more women lost their jobs than men in this measure of employment. You look at the very right-hand column and you look at the change in total wages. Well, men's wages fell by 7.6%, so a big fall. Women's only fell by 1.9%. And when you dig into the data to see why is that such a big anomaly, it's because the professions, the sectors that are dominated by female employment were still at work. Nurses, teachers, carers tended to retain their jobs during this crisis. So they kept getting their fortnightly pay, which is good, of course. Whereas men who might have been working in construction, manufacturing, those sorts of sectors that tend to be male dominated still, lost their jobs or went on to job seeker, which is presumably a lot less than they were earning in their normal roles. So in a sense, we've had this little bit of a quirk, if you like, that the engine room of keeping society going through the COVID crisis, that is our health professionals, our teachers, carers, are the professions that are dominated by female employment. And that's actually allowed women, in this quirky example, to maintain some of their income. Whether that continues remains to be seen, of course. And we're actually going through that debate right now about zero wage increases in the various state public service. And of course, most of these workers are in the public service. Next slide, please. Again, here's a stark chart. This is just monthly data on the change in employment. Again, so it's not just working 0 hours, because they're still counted as employed. So that chart about 3 charts ago, this is the change in employment by gender. In the month of April, you can see there that employment for males fell by about 280,000, so obviously a big fall. But for women, who of course have a starting point of a lower participation rate in the workforce, it fell by around about 340,000. So a huge proportion of women who fell out of employment were women again. So again, compounding that sort of quirk in the data that suggests that perhaps women would say, well, if I've got to undertake childcare or homeschooling because my children can't go to school, it was the female in the relationship that tended to do it, according to these sorts of numbers. Next slide, please. The superannuation withdrawal. Yeah, arguably my biggest bugbear. Ever since I've been doing this work for ES4W the last couple of years, my biggest bugbear is about pay inequality, and then of course linked to that is superannuation inequality. That huge gap that we know is there, still there. And these numbers relate to the withdrawals. You might recall that the government, as part of its package, allowed people to withdraw up to $10,000 from their superannuation accounts to help them through the crisis. These numbers are 1 week old. We had numbers updated yesterday, but it's the same sort of story. So I'll focus on these. Up until about a week and a half ago, 1.35 million people had accessed their superannuation account. Of that, about 770,000 were men, 580,000 were women. So that's probably, again, consistent with men having more money in super and being impacted by the crisis as well, and getting access to their money. They withdrew an average of $8,400. The reason that's less than $10,000 is, of course, the younger person, the younger people who might only have 5,000 or 6,000 in their super, cleaned it out completely. You know, they basically shut down their super account, which is a bad thing. But the number for women was just under that, just under $8,000. Now, when you look at that as a proportion of the average superannuation balance, for men, it was only taking out, on average, about 2.5% of their super. For women, it was taking out 4.5% of their super. So even though the dollar value was a little bit lower for women, it was a high proportion of what is, as we know, a much lower average balance than men have. So that's another skewing, undermines that quest or that goal that we have for superannuation, closing the superannuation gap. This is going to damage that. This policy, which I don't like, is actually going to undermine the superannuation system for these young people, and particularly these people who have pulled the money out of their superannuation balances. And it's hitting women harder than it's hitting men. Now, just a few things to sort of wind up my chat. It's sort of to do with more the health issues. It's absolutely fascinating stuff. The Bureau of Statistics, again, have done a fantastic job asking people different questions about how they're reacting to the COVID crisis. And this is a chart about how people have changed their behaviour, the precautions they've taken to protect themselves from COVID. So keeping a distance, avoiding public space, and cancelling personal gatherings, these sorts of things have been what we've all done to some extent, some more than others. But in every instance, women have been more cautious. They've taken more precautions other than wearing a face mask. It seems that men are happy to wear a face mask, but are less inclined to avoid public transport, change travel plans, all these other, keeping children at home. That's a big difference between men and women's attitude on that. So you can just sort of see there that women are much more cautious about the whole crisis if you look at that whole way that we've reacted to the COVID issue and how we've changed our behaviour. Next slide, please. And this is another fascinating one, and it's sort of really stark again how on a couple of different items men and women have behaved so differently while we've been stuck at home. The good news is that, well, about 10% and 16% of women, 10% of men, have eaten more fruit and veggies. So we've tried to be healthy while we're stuck at home. Women more so. Takeaway meals. Men have had more takeaway than women. Snack foods are where women fall down. So again, and these we can chuckle about them a little bit, but there's actually some health implications here that could be, we could witness further down the track. These aren't the here and now sort of issues for how the economy and how the health system's going, but women have been more inclined to have snack food. And then alcohol consumption, women have been drinking more than men in this lockdown period, which is curious as well. Women are, of course, taking more vitamins, minerals and other supplements to try to ward off the COVID crisis. So again, just little behavioural things. Last slide, and then it's just not surprising if you look at the very right-hand two bars in the bar chart. Are you concerned or very concerned about your health, the implications of COVID-19? Over 70% of women and just over 60% of men are very concerned. So again, that fits to that earlier slide about what people have done to guard against the risk of getting COVID. So again, in summary, and I'm looking forward to getting any questions when it's my turn. The impact is huge on the economy. Everybody's being impacted, but women are the ones that have fallen out of the workforce, the ones that are working 0 hours, they've lost their employment, the workforce participation rate's dropped. So that's going to be a problem. They've been more inclined to access a greater proportion of their superannuation. That erodes that superannuation problem. And it feeds into sort of some of the things that we've had in our white paper and things that are still very much on our agenda, perhaps brought home to roost even more by the COVID crisis. One, about some of our recommendations that were there 2 years ago that are still there today, I must say. We do want to see accelerated pay for the for the industries dominated by women. And right now, you think you'd be able to convince the various state governments to increase pay for nurses, teachers, carers more than other parts of the workforce. That would help close the pay gap. Financial awareness and literacy. So this, don't take your money out of super if you can avoid it. Now, some people desperately need that money, but again, best to keep the money in there. That's one idea. So it links again to financial awareness, literacy, these other things that we want everybody to know about in the Australian economy. Women in particular, as they manage their incomes, they manage their superannuation balances. The other one, paying superannuation, so not just taking superannuation out, but it's actually paying money into superannuation for carers. That was the carers white paper that we did last year. We were seeing that unpaid care work really erodes women's financial security, given that they're the predominant providers of care, unpaid care. Childcare, we had this free childcare for a short period of time. Absolutely vital for encouraging female workforce participation, so that when this ends, while I suspect it won't be free, and probably it shouldn't be free, I think that everybody's happy to pay an amount for their childcare, but make it affordable, make it accessible, so you don't have to drive 20-30 k's to drop your children off, and make it affordable. So childcare is still a dominant part of our recommendations. And then I think they're the key issues. There are a few other issues there, but that's sort of what's happening. We're going to get a lot more data as this thing passes, hopefully, and the economy slowly recovers, but we'll probably talk about that later in the year. But that's where we're at right now. So thank you very much.
Thank you very much, Stephen. Brilliant overview and really great way to frame our conversation today. What I'm going to do is I'm going to invite just one question. If anyone's got a quick question for Stephen, because we'll keep scooting through and there'll be more time for questions at the end. Kelly King, would you like to offer a question to Stephen?
Hi, Stephen. Thanks very much for your presentation. It's really interesting to see that data. I was just wondering if you noticed any difference between metropolitan and regional areas, or if that information was even available in what you had a look at.
Yeah, it's not available yet, unfortunately. While the ABS has been sort of fast tracking a lot of its data compilation and what it's publishing, I think that those data will be available on some of the labour market numbers like employment and wages, but we don't have it yet. They get the data, they sort of like dump it out as the sort of key data. That disaggregated data is probably still a quarter away, so a couple of months away from being published.
Beautiful. Thank you very much, Stephen. Thank you, Kelly. So let's skip along. I'd like to introduce the second member of our panel. This woman's name is Julie Kuhn. Julie is a white settler of migrant refugee parentage. She lives on the land of Kulin Nations. She is a feminist, social worker and activist. Julie gets to lead an organisation that is about living her values and about creating the change in the community that she wants to see. WIRE is the only free support, referral and information service to any woman, gender diverse or non-binary people in Victoria seeking that support and guidance. WIRE is also a leader in the gendered financial wellbeing space, offering support to women, offering research and training. Today, Julie's going to speak about COVID-19, the dirty finger in the crippling wound of financial insecurity, looking at financial inequality and intersectionality. Thank you very much, Julie.
Thank you so much. And when I was asked to speak, really, and to speak about women, the thing that really occurred to me is which women do we need to be speaking about? And a lot of what I'm talking about, WIRE has a telephone support line and a web chat and an email response to women and gender diverse non-binary people, which we have kept going even though we haven't been able to keep going face-to-face support. And the stories that we are hearing about the impact of COVID-19 is really showing that some women are impacted more than others. So what we've found is that the impact of COVID-19 has amplified the oppression, the marginalisation and the discrimination faced by certain women. The impact of higher unemployment, economic contraction and social isolation disproportionately impacts the financial security of some women. And we need to look at this through an intersectional lens. It's easy to see that those that are already suffering at the hands of a system and culture that excludes, invalidates and demeans people because of their race, their religion, their gender, their sexuality, their ability, their socioeconomic status, and many other things, is only going to be impacted more as we come into a place of further hardship and disaster and economic downturn. And I just wanted to give a brief definition of intersectionality. I'm sure for many people you're very much across it, but I never like to make that assumption. And a simple definition of it is it's the complex and cumulative way in which the effects of multiple forms of discrimination, such as racism and sexism and classism, they combine to overlap and intersect, especially in the experience of marginalised and individuals or groups. And in short, what that means is that not all women experience disaster and financial downturn equally. So that's really what I want to talk about today, because when we talk about let's deliver policies and have programs aimed at women, those that are most disadvantaged often miss out. They're the ones that aren't included. And it really takes a lot of intentional planning for mainstream organisations who are naturally more inclusive of white women, women that speak English, or have other advantages such as education and class. And they end up not including those that most need the support. Too many points look at that one point of oppression, and we have to look at those wider points. A case in point, if we look at the gender pay gap, which at the moment is 13.9%, but in Australia we do little work disaggregating which women have a bigger or less gender equality gap. And we know that in America, where they do these studies, that there is a huge difference between the gender pay gap of women that are white and the gender pay gap of Black women and Hispanic women and women, Native American women. So according to ABS stats, women from migrant backgrounds are nearly 11.9% less likely to be employed than white women. In March 2016, there was a report that Indigenous women earn $349 a week less on average than non-Indigenous men, but also incredibly significantly, they earn $111 less than non-Indigenous women. I mention this because when we're looking at disaster and how it hits an economy and contracts, those that are most likely to lose their jobs or already be experiencing that disadvantage and racism and other points of oppression are the first ones that are going to be hit. They're the first ones that are going to lose their job. And they're also the ones that are less likely to have a buffer to deal with the financial consequences. So I want to talk about some of those points that we are now seeing. So one of the things that we've been seeing at WIRE, and I know that's been seen by many women's health services around the state as well, is that there's been a big increase in international students and temporary visa holders not being able to afford food, heating, housing, and the basics of just everyday living. In particular, we've noted that international students and temporary visa holders are no longer able to afford their terminations if they require it, which has severe impacts on their access to reproductive health. And that impact is because of their financial situation. It's also these people that are less likely to have a buffer, that are more likely to be unemployed, that we are denying JobKeeper and JobSeeker to. As a society, we've made a choice to turn our back on these people and their pain and suffering and see it as less worthy at this time of disaster. Sex workers, through social distancing rules, have lost access to their earnings, and due to stigma and discrimination, and find it more difficult to apply for things such as government income or to go to a social service. When they attend these points in our service delivery system and in our safety net, they're often confronted with judgment, misunderstanding, and just downright discrimination. These are also a group of people that are experiencing massive over-policing at this time and are experiencing much financial hardship. Another group to look at is women that have been incarcerated. These are people that increasingly have always had difficulty entering into the workforce after incarceration, and due to the stigma that brings with it. But during an environment of high unemployment, these are the people that are going to find it even harder again. And we all know the likelihood of winning tax lottos is incredibly small, and in order to gain financial well-being, their only way of doing that is through achieving not only work, but achieving stable work and decent work with decent wages. And it is not only incarcerated women, it is older women, it is women with a disability, it is Indigenous women, it is women of colour that are all have a barrier in order to achieve employment, which is going to be made harsher during this time. I also want to talk briefly about women experiencing family violence. There can be a really deep impact when they are having to work remotely, when it is the place, the home, which is the site of the abuse that they are experiencing. For some, working from home means that one safe place has been denied to them and taken away. They are now have found that their abuser has got new fodder to exert power and control by their home becoming their workplace. This has a huge impact on people's ability to remain in the workforce. Hospitality workers, which have a high percentage more likely to be women, have been hard hit with the reduction to penalty rates that we've recently seen, and thus reducing their ability to save money. They've been hit again by the closure of the pubs, the cafes and the restaurants. For many of them, they've had less than 12 months of continuous service as a casual, and this has a high level of casual workers in it. And thus again, they have not been eligible for job seeker. Once again, we see those that most need economic support, those that are more likely to suffer, are the ones that are least able to receive it. And last, I also want to talk about, older women experiencing ageism. And we have seen a spike in elder abuse and abuse towards older people because they are seen as the reason why we've had to have social isolation and restriction. And again, when they're looking for employment or when they're looking just to be treated as equals in society, this COVID-19 is heavily impacting that. Now, there are many more examples I could give around women with a disability, but I'm hoping I'm just providing that general flavour of how not all women are the same, and that I'm really hoping that through the work that Economic Security for Women do, what WIRE do, and what we all do in our workplaces, we really start looking at how do we make a targeted response, and we work with those communities so that there is equity and that their needs, the needs of the people that have been most heavily impacted, can be addressed. Thank you.
Beautiful. Thank you very much, Julie. I recall my personal reflection at the beginning of the pandemic and some of the early announcements, things like an increase in job seeker allowance. And it made me think deeply about, wow, we have this moment where the pandemic is shining a light on the great inequalities and the gaps in our community. And your presentation today has so beautifully illuminated that when we see the gaps and we take some action to shift them, we can shift them for many, but actually sometimes we're letting those on the margins fall further to the margins. And the really challenging thing is bringing those communities that are on the margins right to the middle of our thinking, right to the middle of our discussions with government and planning and in decision making. That's extraordinary. Thank you. What I'd like to now do is invite any questions, inspiration or stories that anyone would like to share with Julie or direct to Julie. I know she set the bar a little high. It's hard to know where to begin. So nothing that people would like to share or inquire into? Like, one of the things I often think of in these moments, Julie, is where do we go with the first step? What is the first step? And when you talk about intersections, it can feel overwhelming. That's my personal reflection.
The thing I would say with that is we need to talk to the communities themselves.
Yes,
The
yes.
other thing is we need to listen.
Yes.
And then we need to do the action. And
yes.
we often maybe do one, but we don't do all three.
Yes.
Because the communities themselves often know what the answer is.
Yes.
But we often say it's too hard. It's too hard to translate it into 10 different languages. It's too hard to take certain things into account. And we often just assume that the dominant way of doing things is the best way. We tweak around it.
Yes.
And over and over and over again, people have been surprised to find that Indigenous services are far better. And maybe we need to be looking at what marginalised communities are doing it and adapt it to the mainstream, rather than just making the presumption that the mainstream is correct and we've got to adapt it to the community groups.
I think that's really apt when you think about funding models with deliverables and the like. At the risk of being a little cheeky, I would like to invite Kylie or Wendy, if you had any reflections or offerings you'd like to offer to Julie. I'm pretty confident that both of you would have something to share. Kylie, it looks like you're ready to turn your mic off.
I am, and I want to thank Julie very, very much for that presentation, because it gave us such a broad scope around not only intersectionality, but the reality. And when you spoke to people in the margins, falling through the margins, that's definitely where I work within. And if you look at us all today, we're connecting by technology, but there are a lot of people out there within those groups that don't even have access to technology. And so I find it really, really interesting around how do we engage those people outside of that. And what you just confirmed to me is it's really that keeping it simple, communicating with people, looking at what the social capital of those groups are all about and what's important to them. And so I work in disability and particularly in technology of late, where the assumption is often people with a cognitive disability don't really need to access social media or Facebook, etc., etc. And the last 3 months has totally tipped that on its head. Yesterday, for example, I had a group of a dozen people interacting with communities in the States exactly around activism and what it means to be an activist and outcomes, and just conversing around topical conversations which so many people miss out on because there's not the forums. So it's probably not more of a question, but more of a statement of acknowledging exactly what you're saying and having an experience of that most definitely in the last 3 months, with very minimal financial remuneration for it. People, the women that I'm working with, are engaging because they want to improve their skills and they want to be part of the communication and change the community narrative around who they are and what their capacity is to be in the community.
Thank you. Thank you.
Thank you, Kylie. Wendy, I'm going to offer you an opportunity to offer something in the way of a question or reflection for Julie after having put you both on the spot. Thank you, Kylie, again. Over to you, Wendy. I think you're still on mic. Mike, you're not on mic, you're on mute. Sorry, we control that sometimes.
Okay, yeah, I think there's a lot of really important things around us now proving that we can do things differently to the way that we've done them before, because we have to, and we've been forced to do it. So for a long time, for example, disability communities have been asking for telehealth and being told this is going to be very difficult, it's going to take 10 years, you'll have to wait. And it turns out that overnight telehealth is something that can be offered quite easily in conjunction with face-to-face appointments when they're necessary. Also workplace flexibility. So we have been told for a long time that workplaces can't be organised like that, and it turns out quite quickly they can be organised like this. And so suddenly, not only is the world between metro and regional organisations more accessible, it is more accessible to a range of people with disabilities. So we now know, because we have that clear evidence, that we absolutely can do it that way. And I hope that we've learned from that and that we don't go back to normal.
I really agree, and I've had many friends that have just gone, the surprise moment was all these things that were too hard, were too expensive. Now that it's become a mainstream ask, were done within 2 weeks. And in some places became compulsory rather than the option. And whilst they're absolutely delighted that they're now available, there is a tinge to more than a tinge of anger, that why, when they were really saying quite succinctly how it could be in place, it was just knocked back. And I suppose that was the part I was talking about, that when you're taking something away from the mainstream, it needs a lot of intention there, because our natural biases come in about what is appropriate and what's not appropriate, what's doable and what's not doable. And we need to talk to communities because they know where the challenge needs to be. And it is about coming together and working together to work through it, and asking the question, why will the sky fall in if we have if I meet with my psychiatrist online, you know, it's all, yeah. So thank you for those comments, Wendy, and thank you, Kylie, for yours too.
It's a really profound reminder that, and I use the expression often about the soup we swim in. So unless you look at the soup we swim in, you don't see other people's experience, and you don't see the opportunities and sometimes privilege that you have. And I think that's a really stunning reminder about the pandemic. I think I'm in an article Tanja Kovac wrote, is beautifully put. The pandemic has been devastating for everyone, and it's been more devastating for some. You know, there's some communities that have carried a bigger load, that have been left further behind, that have been left with a bigger burden to carry. So the world is not an equal place, and it's particularly impactful at such an enormous time. So thank you very much, Julie, and Kylie and Wendy. So next, I would love to introduce Mary Crooks. So Mary is the Executive Director of Victorian Women's Trust. Mary is an outstanding leader in the advocacy around women's rights. She's held incredibly high regard for her commitment to public policy, feminism and social justice. She has worked tirelessly championing for women and girls with the quest for gender equality, and has been Executive Director since 1996. I'm thrilled that Mary's able to be here today, and I look forward to handing over to you now. Thank you, Mary.
Thanks, Emma. I better just get sorted here. Thank you. So look, I don't have a PowerPoint like Julie, but I do have a set of 6 propositions that I wanted to put to people, and these are premised on 2 axioms of mine. One is that if you can't see a problem, you can't fix it. And the second one is that your solutions to problems will be as good as your analysis of the problem. So with those 2 sorted at the beginning, let me just go through the propositions, and I think they've actually started to be pretty neatly illustrated and underscored by the presentations of Stephen and Julie, and I'm sure Tanja will affirm them too. But the central problem for many, many, many decades, let's say even over the last 120 years of our social, economic and political history in this country, the central problem over all this time is that the home has never been declared a workplace. It is a thing. It is where people live. It's often where families live, and it's often where women live. But it has never, ever formally been recognised, acknowledged, or defined as a place of work. We talk about unpaid work of women, but we actually don't formally define the home as a workplace. It is where women are and where they do lots of busyness, and they do lots of caring, and they do lots of cleaning, and they do more household work than men, but we haven't declared the home as a workplace. So it's invisible in gross domestic product. It's invisible in a lot of our policies. We are habituated to the notion of home not being a workplace, and women as well as men are part of that habituated thinking, that we don't step forward and proclaim it as something different from what patriarchy has determined it will be. And because because it's invisible and not codified as a place of work, it means that women who do most of the unpaid work, most of the time, are not remunerated for it. They have no annual leave, they have no sick leave, they have no super provisions, no superannuation. How can they, unless somebody in the household is paying for it? And if there are economic benefits, such as family benefits paid through our tax system, they're not personal to the woman. They're actually for the operation and functioning and care of the family. So that's the first proposition. Tied in with that is that when we talk about women's workforce participation, which we only ever talk about in terms of their paid work, but in fact what women are doing is working two worlds, and usually at the same, in the same week, for example. So they will straddle two worlds of work, what they're doing at home and what they're doing in the paid workforce. And as has been cruelly and ironically shown during this pandemic, it's women who are for the most part taking on more pandemic pressure in terms of the schooling issues, the childcare drop-offs, the anxiety about whether your child is safe to go to kinder, looking over the homeschooling. Now, I'm quite sure men will be in there playing a role, and I've heard lots of good stories of, you know, that he will do the morning segment of 4 hours and she will do the afternoon. But for a lot of women, that kind of fractions at work are not going to be as positive as that. So they're actually taking on more work, unpaid work at home during the pandemic. And ironically, as Stephen pointed out, the work that they're often doing in the paid workforce as health professionals, as women working in aged care, kindergarten, teaching, they're actually not only being deemed essential in that paid work, but they're actually working in areas of supreme stress in the paid workforce, of, you know, coming home with their hospital gear on, taking it off, going into the laundry, stripping down, doing a load of washing, then stepping out into the home to do some more work at home and repeating the dose the next day. So in that sense, the stats show that women, you know, are being hit by COVID in a lot of ways, but even then, I think the demands that are being made on women because of paid work and unpaid work are probably much greater than we even conceive. The third proposition is that childcare is not seen yet as a linchpin to economic recovery. It is seen still in lots of people's minds as an issue for women, because that's how it's been treated, that it's to enable women to join the paid workforce. Whereas childcare is in fact an enabler of men and women to enter into the paid workforce on better terms. It's an enabler of men to work for and achieve a degree of flexibility in their workplace, which might in fact, with a bit of incentivisation, sorry, John Howard, might translate into men taking on a more proportionate load of home domestic labour and caring. So childcare is still seen, in my view, as an issue for women and not an issue for men and women working in households and beyond. And it stands to reason in a way that if the men who hold the policy levers over decades, if the men in Treasury and the men in the Department of Employment and the men in Department of Children's Services and whatever, but if the men holding the policy levers have never actually conceptualised childcare as their issue, then they're not going to see it in proportionate terms as a key part of economic recovery. So I think when we hear talk from the national leadership about the need for economic recovery and snapback or not snapping back so quickly, then we have to understand that one of the most important keys to generating economic recovery is going to be quality and affordable childcare for everybody who is in need of it, and not a question of the capacity to pay of people across the community. We should be pressing really hard for a scheme that is not seen as the responsibility of a household. The fourth proposition, and I know, and I'm across all the stats that show, you know, how older women in our society end up in terms of economic security stakes, that they're more likely in their 50s and 60s to retire with poor superannuation, and they're more likely maybe to even face problems of homelessness and so on. But leaving that aside, I think that one of our big challenges through and post-COVID down the years is to be making sure that the women who are now in their 20s and their 30s are in fact very, very strategically supported in terms of pathways to employment and trying to get some guarantee into workforce participation, that younger women are able to get a start in their professional lives in their 20s and 30s, because if they don't over the next decade get a much more sure-footed leg in to full-time employment or substantial employment that is reasonably well paid and where they can start paying superannuation, then the effects of COVID will be felt in 20 and 30 and 40 years' time if we don't have a particular eye out for some fine-tuning of our economic responses that do better, preferably by younger people all around. But because women are behind the 8 ball most of the time, the younger women in their 20s and 30s now, if we don't actually keep a special eye out there, they will be so far behind the 8 ball when they're 40, 50, 60, it won't be funny. And one of the things that ties in with that is that we can't just be talking about packages of economic recovery that are more likely to suit men, such as housing and construction. We have to be looking at mature ways of defining infrastructure and recovery that are more likely to hold pathways there for women. My fifth proposition is that COVID's impact, which has been beautifully illustrated in Stephen's slides, for example, COVID's impact on women is not simply the impact of a pandemic. It's actually exposing the inequalities that exist. They exist, they're writ large. It's just that oftentimes they're scuffed over by a bit of, dirt and sand. It's a bit like going for a walk in a park and you walk under a tree and you scuff over the stuff on the ground, and you find these enormous, great big roots that are there, and they're fairly permanent. And the thing is that what COVID's doing, it's not unlike the kind of way in which when Julia Gillard was Prime Minister, the seams of sexism that were there in our society were actually exposed in all of their ugliness. And what we're seeing now is the pandemic is actually showing us, in retrospect, where the inequality exists in our society and where the gendered inequality has had such a foothold over many, 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 many decades. And my point here is, if we don't understand that the current expression of the impact of COVID is in fact a manifestation of these deeper inequalities, then we'll be stymied in our vision of how do we get out of this and how do we build something positive from it. My sixth proposition is that we have to see 2020 and 2021 and 2022, the years that the immediate years that it's going to take to see ourselves through this pandemic and beyond. We have to see it as not just about a slow, sure, steady economic recovery. We have to actually see it as an opportunity. It's a defining period in our nation building. It's a defining period. And what we do get right and what we don't manage to get right over the next 2, 3, 4 years will define us for many years to come. So this is not about being hopelessly optimistic. It's about, however, being clear-eyed that there are times in the life of a nation when some things say something important about us and what we've got to wrestle with if we want to be even better than we've been when we come through all of this. And this is one of those opportunities or one of those significant points. And so the question we've got as a defining opportunity is do we Band-Aid? Do we keep slapping Band-Aids around when the sore is exposed? Or do we actually try and alter the policy prescriptions that we haven't been able to manage so far? Job security, pay equity, housing, superannuation reform, and women's unpaid work thus far. So I think we've got to keep our eye on the structural game and not get caught up only in the most immediate analysis and impacts of COVID. One of the positive notes I'd finish on that we have to hang on to is that COVID has been bringing women's voices to the forefront and women working with one another more than we've been doing over the last several decades. There's been a fragmentation amongst women and organisations, not by choice, but by developments in our society. There were pre-World War II, there were women's organisations with thousands and thousands of members who actually worked together across the political spectrum, from conservative women, the Country Women's Association, right through to union women. And I think what COVID is starting to do, thankfully, is to actually start to bring a coalescing of women's appetites for change and for knowing that we actually won't achieve much unless we do band together and step up and make the demands. Thank you.
Thank you very much, Mary. What an eloquent drawing together of and a call to action. I would like to extend an invitation to anybody to offer a question or a story or a reflection with Mary. If anybody would like to raise their hand, I wholeheartedly welcome it. And as you might have noticed, I'm not afraid of the direct approach. Certainly Kylie and Wendy can share that. I've got to actually inquire if Vani, as a younger woman, the piece around the vulnerability or the lingering impacts of COVID for younger women. I'm curious, Vani, if you would be happy to offer a reflection or some thoughts in response to what Mary's had to say there.
Definitely, like, it's been quite difficult during this time because I have just left from school, and with a certainly difficult year. So I was hoping to get into uni this year, but then I realized as a permanent resident, I was not able to qualify for a youth allowance. So that was the main reason why I took a gap year off, to actually start to find employment and find jobs. But that's when this whole situation came about, and it's been hard ever since. From March till now, I've just been applying for any casual roles that I can get, because one, I do not have any like TAFE courses like to back me up, and I can't do any at the moment, such as like the coffee making TAFE classes or something that can get me started with a job. But so I've just been cooped up at home with no job seeker payment too, and no way of earning anything, which is leaving me in a situation where I'm even contemplating whether I'm able to go to uni next year, because it's been just financially hard, and my parents can't support me because at the moment, because my mum is the only sole earner in the family and she's the sole breadwinner, and my dad is also unemployed and unable to receive job seeker payment because he's also a permanent resident. So yeah, that's my current situation, and honestly it's like between two hard places, and I'm not sure what else I can do rather than to find jobs elsewhere than Warrnambool at the moment. Yeah.
Would anyone on the panel, particularly Mary, I'll offer that, whether you'd like to respond to Vani first there?
Yeah, just quickly. And I mean, I think, I think it's a really important illustration of that wider issue as well, that if we're not careful, we'll see a raft generation of younger women whose talents and capacities aren't able to be realised, and they'll be behind the eight ball. I would think in the meantime, I think it's especially tough in a lot of regional areas as well to get the kind of work that might be a head start. But from a practical point of view, one of the first things I would do would be to stay connected and to be able to work through some of these issues is to find a really trusted mentor. Find a mentor real quick and start to try and have somebody take a little bit of the load off your thinking shoulders as you try and negotiate this tricky time.
Thank you, Mary.
Thank you very much, Mary. Julie, adding to that?
Yeah, Vani, I just want to compliment you on everything that you've been doing. The way that you you held yourself together as you told that story, that is sitting with you all the time. The resilience and the strength really shone through, and that you're dealing with more and your family is dealing more than they should, but you are. And I really just want to acknowledge that with the larger group, and that it sounds like you are doing so much to support yourself, and I really wish you well with that. And as Mary said, if there is someone that can also take some of that, something off your shoulders, because there's more than what any young person or even older person should have on their shoulders at the moment.
Beautiful, thank you, Julie. I'm going to do something a little unconventional. I'm going to throw in the mix, Vani. We've only met once, but I would happily, as a local woman, put my hand up if you wanted to consider me as one of the list of great mentors you might like. So pop that one. I'm really happy to follow up with you after this, but I'm absolutely wholeheartedly happily if that would be something you would be interested in without any hesitation.
Definitely.
So let's leap. So thank you, Vani. I too want to really acknowledge and appreciate and thank you wholeheartedly. Moving into the next presentation. This presentation will come to us from Tanja Kovac. Tanja Kovac is the consulting CEO of Gender Equity Victoria. Tanja too is a renowned and accomplished activist. She has been at the forefront of making large change around gender equality in our state under the late Fiona Richardson in her own independent work. Tanya's someone I've got to know over the course of this year in her GenVic role. We're about to hear from an extraordinary woman capable of extraordinary things, and I really look forward to Tanya, who's going to take us through gender, disaster and resilience. So a bit of a framing of this discussion and certainly pulling out the gender dimensions, which have been so powerfully illuminated and discussed today. So thank you, Tanya.
Thanks, Emma, and thanks everybody. I'm controlling this PowerPoint presentation remotely, so bear with me as I attempt to do that. Thank you very much for having me today, and given how all of the wonderful presentations that I've already listened to, I was very conscious that coming at the end that I didn't want to repeat too much of what had already been canvassed, and so we'll be focusing specifically on the gender disaster and resilience work and the statistics that are underpinning that within Gender Equity Victoria. So I'll just acknowledge the traditional owners of the land on which I'm meeting and pay my respects to elders past, present and emerging. So just to give you a snapshot to remind you that this COVID-19 really is a gendered health problem. So what we know from the statistics is that this is actually impacting in terms of the health outcomes, this is having a bad outcome for men when they get this disease, the virus. Why is this important? It's important because what Mary was talking before about data, having sex and gender disaggregated data is fundamental to having health solutions, but it's also fundamental to having economic solutions. So it's not always the case that government does a good job at presenting information like this so clearly. And one of the other things that I think is coming from COVID-19 as an experience is that we are seeing a bit more effective reporting in relation to the differential impacts of COVID-19 on men and women. And, you know, clearly there's some work still to be done around including gender diverse people in the analysis. In terms of infections, we can see that there's relative equality between the sexes in relation to the infection rate. But interestingly, there are a couple of pockets where women are clearly being infected more. And it's interesting that it's around the 20 to 29 age group. There are a couple of other spaces where there's a slightly marginally higher rate. Once again, the analysis and the data that government needs to be doing from a pandemic planning perspective, we would expect there to and want there to be, in order to prepare for a pandemic into the future or respond to any disaster into the future, that we would be expecting for there to be some drilling down into the analysis of this. Why is the data presenting in this way, and what does it mean? We need to know the answer to that to limit the impact of future pandemics across different age groups. And we also need to understand how we can better prepare women and men for the kinds of experiences that they might have in the workforce, because clearly there is a workforce exposure component when you look at this. So, you know, there's physical differences, physical health differences, but there's also quite considerable mental health differences for coming out of COVID-19. So, and very worryingly, it's clear that women are bearing the great mental health burden of COVID-19. To go really deep into those statistics, we've got research that is establishing that 35% of women are having moderate to severe levels of depression compared to 19% of men. 27% of females are feeling stress compared to 10% of males. And I'm really particularly concerned about the next statistic. So among women between the ages of 18 to 24, 37% of them are reporting suicidal thoughts compared to 17% of men. That is not usually the case in relation to suicidal ideation. So there is something particularly about COVID-19 and the cumulative stresses that are on women, in particular young women, that is causing them to feel unwell. And I think Mary touched on some of those things. You don't have to go very far, and we haven't had to go very far from this discussion to find young women who are struggling and with direct experience of COVID-19 being traumatic, but also to have the wisdom and foresight to see what the likely implications are moving forward across their life. So, you know, I think this is a particularly alarming statistic, but it cascades into other, you know, there are just other more general observations. Women are more lonely than men during lockdown. They think everything is an effort. They're more nervous. And of course, this, as Stephen reiterated, there's having an impact in terms of consumption. So a gendered consumption around unhealthy eating and also alcohol. Oh, what I've done there. Where have I gone? Sorry. So in terms of the health impacts, we also see that COVID-19 is a gendered health problem because of the impact that we're having in relation to the workers who are performing so much of the essential service workforce. So in the United States, Italy, Spain and Germany, most of the people who are being infected are healthcare workers, and most of them are female. I feel like we haven't drilled down. We've been lucky in Australia because we've had less infections and less death to not warrant as much analysis. But I do think that it will be very interesting for us to look at how many nurses, how many female doctors were infected during this period, and to understand the exposure. I'm particularly interested in this issue from obviously in Victoria, there's a high level, to repeat that, there's a high level gendered workforce in Victoria in nursing. I'm particularly interested in the fact that women have largely borne all of the responsibility for being the essential service workforce. This is a surprise to everybody. I don't think pandemic planning nationally foresaw that we would be relying on this infrastructure of women workers to keep us fed, having our children provided with education and childcare, and basically creating the scaffolding of the rest of the economic work of the country. And that the fact that so many of these workers are then also in the lowest earning professions in the country is both an opportunity as well as a problem. So there are things that we learn from COVID-19, but we also can say that there are things that we need to advocate for in relation to, you know, so many of these workforces have had to operate in terms of a COVID-19 without access to PPE equipment. So if you were taking a gendered lens in relation to pandemic planning for future disaster, you'd be wanting there to be an onshore manufacturing industry for PPE if you were a woman, because you're likely to be in the front line of needing to have a mask and having protective equipment. And if we can't guarantee that in this country, then it's women workers who are likely to be sick into the future. Mary touched on this, but I just wanted to share with you that the value of that unpaid work the value of it has actually, that we think women have been doing across COVID-19 has been actually looked at by the state government, by a piece of research that they got Deloitte's to do. And the value of it is $205 billion per annum. So that's 4 times the size of the state budget. And what Mary is quite right, we're not absorbing the meaning of that and adapting that in terms of policy solutions. And of course, you know, Stephen's gone through the impact in relation to employment. In relation to disaster and violence, we can tell you that there have been, you know, ominous reductions of calls to Safe Steps early on in the pandemic. Safe Steps is the general phone line for people who are exposed to family violence and need assistance. We're assuming that those reductions in contact were due to women not feeling safe enough in lockdown to actually make phone calls or reach out, given that they were in such close proximity to perpetrators. We've seen 200 plus calls a week to VicPol, a 50% increase to the Magistrates Court, and a 94% increase by men themselves worried about their own behaviour. It's a complex issue, violence and the implications of disaster. And for GenVic, we haven't just been looking at COVID-19, we have also been looking at communities that were already traumatised by disaster over the summer bushfires. Let's face it, we were missing PPE equipment in Australia since for quite some time. So for us, the question of gender and disaster work is specialist expertise that is going to require national and state and probably local investment going forward. We're lucky to have international and national links to some award-winning research that was built on our knowledge in Black Saturday bushfires, which establishes the causal connection between disaster, a return in families to very strict gender roles, so codified behaviour for men that is all heroic and strong, and women in care and sort of backing up roles within the home. We have a very big return to that in disasters that causes conflict in families and in communities. And, you know, this is a proven global phenomenon, and we're going to need to have responses to it. What can we do? Quite a few things. We've got GenVic has been working, as Mary has foreshadowed, has been working across different gender equity organisations. We haven't actually had a peak organisation for women's equality for very long in the state of Victoria. And so we've got now 92, it's gone up again, 92 organisations that have endorsed the Gender Equity and COVID-19 joint statement. We're calling very strongly for a gender equal economic recovery, and that important call for the analysis, exactly what all of the speakers have been talking about, the importance of having that sex and gender disaggregated data is fundamental to us. So there's lots to learn for gender equity from COVID-19 and disasters generally, and certainly things that we think government could be doing right now.
Thank you very, very much, Tanja. Do we have a question or inspiration to share with Tanja Kovac there? I have that cautious reminder that I'm not beyond a direct approach. So,
Emma, it's Mary.
Yes.
Tanja, I think the mental health data that you showed is pretty powerful, and you talked about it in terms of, you know, pressures on young women. And I think that that's probably justifiable. But I also wonder the degree to which, I mean, either that data, a cynic might say, well, you know, women, you know, if they've got high levels of depression, well, you know, they're not coping, blah, blah, blah. Whereas I'm wondering whether or not, in fact, it's a further argument about the double and triple whammy that so many women have to carry across the workplaces. So the fact that a lot of men might be less inclined to an increase in depression around the pandemic might well be because they're just simply not bearing the same emotional and psychological and physical load. And I think there's a point at which for women, it's how much can a bear bear?
I think that's absolutely clear. I think that, and this is, you know, we don't have and haven't had a functional time use survey nationally for a long time. And that's just one set of data that we really, like, we're arguing to try to get that reinstated when actually we need to be moving beyond it to collect better data and drill down further. And, you know, there's just not enough research to be able to explain it. And I'm concerned that there won't be enough gathered at this point, and people will start to forget about how dramatic this was for them on a day-to-day basis.
Agreed.
Wendy, what would you like to add to that? Thank you, Mary. Thank you.
Yeah, there's a little bit of research coming in, particularly in relation to carers of people with disability or aged care disability. This one's from Caring Fairly, and their numbers are really high around mental health as well. So 89% of the respondents identified as female, and 81% had said that their mental health had deteriorated. So that's pretty clear in that group as well. And there's a couple of other interesting things out of that. It's quite clear that a lot of carers have given up paid employment so that they could do caring work at home. 37% of these respondents lost some or all of their regular income. 37% worked fewer hours to provide extra support for the person that they care for. The other thing is experiencing increased living costs. So on top of having lower income coming in and more pressures in the household, 71% experienced increased living costs as well. So for things like medications, they can't get the kind of medications they did, so they have to buy or pay for whatever they can get. Special kinds of foods they might not be able to get, and so they're having to pay for more expensive brands. PPE equipment, so they're talking about in their own homes, they were having to buy PPE equipment and having trouble getting that as well.
I mean, Wendy, I would say to you that, I think the best thing is for us to try to bring all of this data together. I mean, there are things that have been shared today by Stephen and others that I hadn't seen before, but that is becoming needs to become part of the dialogue that all of us who are talking about the impact around gender, and to try to get all of us sharing this information. So I'd be really interested in getting access to where you're getting those statistics from, because clearly the question of the care work of women is a huge part of us articulating the gendered impact. So if you're able to, share that either in the chat function or send it through to Emma so that it could be shared more widely, I'd be appreciative of that.
Yep. I'm really happy to facilitate that so we can do as much sharing of the data. I guess it's that stuff of we need the data to start to tell the story. The data plus women's voices and your experience are the two pieces that enable us to advocate for change, to enable Tanja to meet with ministers and the like and present a compelling case for a lived experience that is unequal.
I think, can I also pick up, Emma, just on one of the other points that was raised around how pandemic overlays existing inequities. So we've been talking as a peak about the lack of funding for gender equity work. at a state and federal level. And during pandemic, you can see the impact of this when money is diverted out of the core, out of the predictable work of government to deal with a crisis, that there is no fat whatsoever, no contingency monies sitting around to enable gender equity work to be scaled up. So we're talking about here really complicated issues and wanting, and at a level of sophistication that is not matched by the kind of funding and investment that you need government to be putting into to actually understand it, first of all, and then come up with solutions. So one of the layering impacts right now is that, you know, there's just not enough money going into all of the organisations and the activities that we need it to in order to address some of the fundamentals for women at a local level. I mean, I would very much like, we called for in the Gender Equity Joint Statement, we called for there to be a stimulus boost to families in recognition of the educational support that they were providing at home. So picking up on Mary's point about the work, about the home as a workplace, we suddenly expected women to perform parts of the job of teachers, and it was mostly women, without any pay. And we're so used to doing that, things like that. And there's no solution, there's no, you know, space within the education department nutting out the gender implication of that, I can assure you.
Thank you very much, Tanya. Beautiful summation. I'm mindful that we're flip-clopping along. So what I want to be mindful of is that it's just after 1:30. So that's the space where we held, and I hope that everyone's had the opportunity to ask questions or to speak to the panel members. What we're now moving into is what I was saying, that sense of flipping the focus. I've seen a couple of people have needed to leave us, and thank you for your participation. We have recorded this and we will share it. What the next half hour is going to be is flipping. So everyone that's on the screen right now has the opportunity to offer ideas, stories or questions of anyone, essentially the panel members and all. Further, we actually have a couple of things that have come in through email and Facebook, just to flag some of the local women's stories. So this section, it's going to be a little more on my toes because I'll have to respond a little more quickly. But just to leap into this space, I'm going to offer anyone in the room, world, screen, the opportunity to raise their hand and kick us off. Oh, and Kelly's got a hand up. Well done, Kelly. Thank you.
It's been a really interesting conversation, and certainly I've learned a lot through it. Thank you. And it's prompted my thinking in a number of different areas, particularly in terms of how we collect and look at the data that we're collecting on water in a gendered way as well. So thank you very much to everyone for that. It has been a very issues-based conversation, which is very understandable. In the conversations I've been having with people in my workplace and in the region as well, though, I see that there's also potentially opportunities that the pandemic has created as well in this space. And everyone's experience is very different, but there's, I've heard, for example, opportunities that people see with new options for workplace flexibility, which could lead to greater workforce participation for women. A couple of people have said to me, a couple of women have said to me they've started exercising more than they ever have during this period of time. There's probably other things as well. So I'm really keen to understand from this group if there's opportunities that you see and how we might incorporate that into our thinking about broader policy and advocacy.
Beautiful question, Kelly. And I think it's a really nice hook to pick up from when Mary was saying before, this is a defining period. What can we carry forward that will actually, that's the opportunity for things to be better?
Could I make a quick response to that?
Of course, Mary, yes.
Yeah, Kelly, I totally get it. And I guess the thing is that, I mean, I can even speak from a personal point of view that there are things that are happening through this that that are actually good and better for me. I mean, I've started doing yoga for the first time in my sweet life, for instance. But I guess the point is that the positives and the opportunities, the way in which people might be slowing down a bit, reconnecting, maybe getting off the consumer treadmill a little bit, those things will flourish, in my view, because people sense the positivity about it and the benefit. I'm more interested, I think, from a policy and structural point of view, in the things that won't flourish unless we are a lot more calculating and actually address the fault lines. So I am interested in what has to give structurally from the past and the present in order. So workplace flexibility, for example, little bits of change might occur there because some people have gone back into paid work, having been in lockdown for a few months and seen some of the benefits of being around the kids and so on. But it will be pockmarked. It won't be systemic, and it won't be of any critical mass. So I think there will be great positives, but unless we actually look at serious change, such as, for example, in the way young women in their 20s and 30s, if they're not paying any superannuation, if they can't get decent jobs that pay properly and can't subscribe to the superannuation system, then what's that going to do for their economic security now and into the long term? That's a structural issue. It's a reform issue rather than just surfing the wave of a positive experience through COVID.
I think I understand what you're saying, but I think there can be something deeper than surfing the wave of this. I think it does. I think things around a significant shift to workplace flexibility potentially. There is a really significant opportunity because people can see the benefits of it right now. I think the risk is that people and organisations say, okay, well, we can go back into the workplace now. Let's just do it and make sure we've got our social distancing right and our desks far enough apart and so on.
Yeah, I agree.
I think that there is a real opportunity to think not about, let's not go back to how it was. Let's think about how we go forward to how it should be. And part of that can also include really significant benefits for women as part of that. And I do think that's a real structural issue for us to consider at the moment, an opportunity that's presented right now.
Yeah, no, I agree. Yeah.
Julie, would you like to add to that?
And I agree with what both of you are saying. And when Tanja was talking, I'm continually dismayed that gender equity needs the fat. It is always considered the trimmings rather than the bones of what we need to get done in our society. And so that's a continual irk for me. And I know it is for I'm assuming most of us on this, or not all of us on this webinar today. I think one of the things we need to be wary of, and it's going back to who are we talking about, is that working from home really advantages me, a white collar worker who has been able to afford high speed internet or as high speed as we get in this country, and has got a laptop and can set up and has got a safe home. Also think about when we've spent quite a bit of time trying to regulate away work from home, when people, especially migrant workers, were being exploited by having to work on by being paid a pittance for piecework in the fashion industry. And so we have to be careful that by advantaging one group by saying this really works working from home, we don't remove our gaze from those that could actually be further oppressed by it as well. So it is just something we need to be consistently mindful of, as well as being mindful about which jobs are able to work from home. And there's a whole range of jobs, again, a lot of jobs that are held by migrants to Australia, people that have been able to get a higher level of education, which can't be done in home and are not going to get those advantages. So I very much agree, but we've always got to look out at who isn't being included in this benefit.
Beautiful, Julie, thank you. One of the things I think about a lot, it's sort of the heart of our health promotion work, is understanding any problem as an individual right in the centre, this ecological idea, and we exist within a family, if that's whatever your definition of family will be, sort of community, so workplaces, schools, social groups, and a society. And it's those broader shells that have a massive impact on your health and on your opportunity and on how you move through a pandemic. So I think those dimensions of that question and conversation illustrate how we need to have lots of layers to our thought around individuals' experiences and around the levels of change that are needed. And one of the reasons, I personally sometimes find it a little tricky when we talk about policy or law because it can feel a bit abstract. But one of the reasons we focus there is it because it can have such a large impact. And the dance then is to see the shift at the population level and then keep bringing communities from the margins along. I wanted to just pause for a moment and do another one of my quick direct approaches. I wanted to offer Afra the opportunity to speak if you would like to. And excuse me if I didn't pronounce your name right. We can't hear you, Afra. Do you want to type a question in or something like that if you can't get it to quite? Yeah, we can't hear you. No. Can you please, Afra, type in the chat function down the bottom of the screen? Yeah. I might jump to the right of my screen over to you, Carmel. Is there something you would like to offer or add? Are they connected to that question or a different question or reflection?
Yeah, it's a shame we can't get Afra because I think she has a lot to add to the conversation.
I thought so, yes.
Yeah, so that's what I'm sitting here thinking, come on. Is her microphone actually showing up as being on your screen?
It is,
you know how
yes.
Okay.
Yes.
Can you hear me now?
Yes.
Yes.
That's good.
Nice one.
I think because of the headphone.
Yes.
That's why.
Uh-huh.
Thank you for everyone to giving me the chance to join the round table, and especially Carmel. And I would like to share my story during COVID-19. I already graduated on March, and my income stopped since that time. And the thing is, I'm searching for a job, but I can't find. It's very tough to survive without income, especially if you have a family and you need to pay for rents or for bills and for many medical issues. My husband has a medical issue, and me also. I have asthma and hypertension. And yeah, now even we don't have a home to live, and it is very hard to survive during this time. Although my resume is very rich, but it is very hard. I can't find a job. I applied many times. I'm not eligible for job seeker, or because I don't have any. I don't have permanent residence. Yes, so that's make the situation very hard for us as a family.
Yeah. Thank you for sharing that, Afra. We've certainly had other women share the experience of the really quick few steps between job security either not coming to life or being taken away, and how quickly that moves to insecure housing, to not having a home and feeling like you're at a difficult crossroads with that. Can I invite anyone who would like to respond to Afra's sharing and story that might like to speak up or pop your hand up? Carmel, yeah.
Just expanding on that, I think it just highlights too where certain visa holders are have been really, really suffering as a result of this. And Afra's an asylum seeker. So, absolutely no support.
Yes.
And to be highly qualified and not get any support is a really hard thing. And, the people who are on those visas are really struggling.
Yes.
Workers and asylum seekers.
Yeah.
In particular.
It illuminates what both Julie and Mary spoke about before around when you make change for the mainstream, those that we haven't thought well about to wrap support around and relationship and opportunity around, like yourself, Afra, become more vulnerable. Do we have any other reflections or additions to that? Stephen? Yes.
And it's just an observation too about the whole conversation, which has been, for me, remarkably enlightening again. And it covers two things. One's a societal change that's probably going to evolve from COVID-19. We're probably going to be more inclined to work from home. That has implications for our employers giving us better IT access and these sorts of things, if you're in that position to do so. Not everybody, of course. And that's fine, but from an Economic Security for Women perspective, that societal change is something that's sort of more a given than something we necessarily debate, in a sense. Our objective is about policy change. If society changes because of these sorts of things, that's great, all good and well, and I think it's important that people take advantage of that. If it allows more women to work from home, terrific. They don't have to commute. They can sort of still do part of the family thing when they're working from home. But from our perspective, it's about policy change. It's about these big picture issues. Superannuation came up many times. It's about the pay gap. It's about recognising the value of work in society, not just unpaid care work, but even the sectors that have a predominance of women in that sector that we don't value as much as, say, a banker and a foreign exchange dealer who gets paid many, many times more than a teacher and a nurse. And the male and female imbalance there is obvious, I think. So what we try to do is, again, think about how we can lobby government, lobby the policymakers, the people who influence the decision, because society will work from home or they won't work from home. Yeah, that'll work itself out. That's going to be very much a business by business decision and an individual by individual decision. That's not a policy issue in my mind necessarily, other than perhaps some of the workplace issues that if you're working from home and you slip on the cat as you're going to make your coffee, do you get covered with workers' compensation and things like that. So there are a few issues, but the big issues for us are about participation, education, skills and training, pay gaps, superannuation contributions, financial education and literacy are really important issues that do require our government, state, territory, federal, to make decisions that improve that sort of thing. So I'm really keen to see these changes. They're fantastic, but we've got to remember too that when we think, well, what do we go away from here and every other engagement that we have with people on these sorts of issues, it's how can we first of all get the message across to as many people as possible so that everybody joins this debate, not just the 30 or so, 40 people, however many were on the call. That's fantastic. But how do you make that 300, 3,000, 30,000 people? Because that's how you get the change going through. And how do we lobby our politicians to realise that I think just about everything that we've been discussing, first of all, it's fair and decent and just basic, I would have thought. And then why the hell aren't you implementing it? Or how can you implement it? So we've got to tell them how they can implement policy.
Thank you very much, Stephen. I think Tanja would like to add to that. Thank you, Tanja. You're on mute at the moment. Yeah.
Yes, Steve. I mean, I think the big thing that's really driving my interest in where this is all going to land now is the extent to which there's going to be a recognition that gender equity and gender equal outcomes are good for economic outcomes. And we are going to have a successful recovery, we actually have to centre our responses around making sure that the recovery is good for men and women. And that picks up on what Mary was saying about seeing childcare as being fundamental to resolving long-term entrenched problems around the way that we recognise that as economic scaffolding. Without childcare and education, men and women cannot work.
Yes.
But we have not had sophisticated conversations about the way that those things are the scaffolding. And I'm concerned, I remain concerned that too much of Treasury is not capable or interested in doing this analysis. And Stephen, I'm always interested to understand your perspective somewhat on this. Our concern is that there really hasn't been effective gender lenses applied with any spirited consistency for a long time. And, you know, we would have thought that government itself, without reference to whichever political party was in power, would be able to drive that itself. And our assessment is that's not happening. And that's why there needs to be strategic work to improve gender responsive approaches within Treasury.
Yeah, and on that, we know that a lot of these things cost a lot of money, and in fact, in the white paper and other representations that we've made over time, these things do cost money. There's no question. We can't hide the fact that if you want decent, affordable, accessible childcare, it will cost the budget money. So if you're advocating that, the finance minister, state or federal, will say, well, how much is it costing? And that, unfortunately, is an issue that must be addressed. The way to overcome that is say, well, the cost of not doing it is even greater. That's sort of a bit of a cliched comment that it might cost a lot of money, but if you don't do it, your workforce participation, particularly for women, but also for men, your productivity in the economy is going to be reduced. So I don't want to sound too much like an economist here, but there's...
No, I want you to.
There's a ton of research from the OECD, from the IMF, from a whole bunch of people that correlate very, very, very clearly that the better the quality of childcare provision from a government, these are global studies, the greater the access to childcare, the greater the economic performance of that economy, because people are able to work, they're able to engage, they're able to maximise their income earning potential, they're able to get further education and study to maximise, again, their ability to work. So there's that sort of argument that's got to be put to the policymakers.
We're going to have this really interesting thing, I think, where we actually for the first time have some really empirical ways in which to measure how successful leadership is. We're going to be able to assess whether the differences between the way men and women have led in relation to health outcomes. We're going to be able to measure that in the sickness rates and death rates in countries. And we are also going to be able to measure, have the things that we have done to get countries back up to normal functioning, have they been done in a way that has centred a gender equal response, and has that delivered a good outcome versus some other mechanism? And I'm really interested in how the whole globe is going to drill down into the analysis of this.
Thank you, Stephen. And Tanya, that's a rare and lovely moment to share. But it reminds me that, I'm coming to you in just one second there, Mary, it reminds me that while we might be looking at the issues, our aspiration, the vision we're holding, the work we're doing here is towards a more equal world. And the more equal world means more people are doing better. So the heart of this conversation is actually about equality and a more fair and just world. Over to you, Mary. We're getting towards the 2 o'clock. Welcome your contribution.
Yeah, look, just quickly, and back with AFRA's contribution. I think going forward, I think people in paid work over the next period of time have a little bit of an ethical responsibility to do what they can to help with the spread of work through either mentoring, through networking, and whatever. So I'm willing, if AFRA is willing, to have an offline conversation about some practical steps that could go on from this webinar. but I would think that everyone in paid work has to actually have an eye over the next months and years to how can we activate networks, how can we spread word, how can we advocate, how can we be part of the activation of paid work for other people, because now with 1 in 5 Australians out of work, there's a particular privilege attached to having work now, and I think that it's incumbent on all of us to try and just do that little bit wherever we can over the months and years ahead, to be part of a spread of work for those who are missing out.
I think it's wonderful, Mary. I think it's a great call to action. Have I spoken over somebody there?
I just wondered if I could speak.
Yeah, jump in, Simone. I was coming to you now. Go.
Thank you. So I'm Simone. I was the Executive Officer for Carers Tasmania's peak body work before I moved interstate to care for my mum just before the pandemic started. So I'm now unemployed. The supplements really made living on JobKeeper payment possible for me to, it's slightly more livable. So if that goes, I'm back in the poo. But I suppose one of the things I wanted to say is just that all people's experience of remote schooling and homeschooling their children is also not equal. So one of the things that has happened for me, and I'm a sole parent of a girl who's probably got autism, but getting even a diagnosis for that for a girl is tricky because it presents differently. So her experience of remote schooling has been, in the end, complete disconnection from school. And so both of us I feel like we're both disconnecting from everything actually. It feels like our lives are almost dismantling from the systems that we're a part of. So my daughter's now in the position of not wanting to go back to school at all, which means potentially I need to homeschool her, which means I can't work. So there's huge consequences for us, and we're really in a place of no man's land right now. So that's our reality, as well as caring for my mum. Yeah. Yeah.
Thank you, Simone. I really appreciate you sharing that. And one of the responsibilities that I, in a leadership role in this organisation, hold is when I invite women like yourself to share their stories, I have to be, like Mary's pointing out, part of trying to make the change so that your experience could be different. So, part of the purpose of us coming together is to have a collection of people with some knowledge and insight into how these systems and structures and law and policy works, and to hear the voices and see if we can translate your experience into change, how we can be advocates for the change we need to see, how we can all take action in this time to make a better world, to build the better world, a fairer, more equal world.
Say for example, if I choose to continue to homeschool my daughter, which I may have to do, I may have no choice but to do, how do I financially do that? And how do I work and homeschool a girl who is on that spectrum and she has dyslexia and extra learning issues? How do I combine those two things? Yeah. As somebody who has a skill, highly professional skills.
Yes, yeah. I'm not going to dob dear Wendy Jones, you'll see on the screen in, but Wendy's part of the Southwest Carer Respite Network. So certainly she has a connection to exactly that experience, Simone. I don't know if you want to add something there, Wendy, or even just make some connection for Simone into that network.
All I wanted to be able to say was that we've again got a little bit of research. This is from the Children and Young People with Disability Australia, and what it shows is that your experience is not unique at all, that parents are experiencing high levels of stress because they're dealing with the exact things that you've outlined. They didn't know whether to keep kids in school or take them out. There was a lack of guidance around that for the disability community early on, and having to give up work to be able to do that caring work burdens those families financially so significantly. And none of that is working the way that our systems say it should be working, or the way that we claim it should be working.
On that note, I would like to really acknowledge and thank you, Simone, for speaking. I would like to also acknowledge and thank every person that's made this space and time today. I want to also recognise that we will put on our website and send out through email a list of supports and services and links that might be handy, that might be valuable. I want to wholeheartedly make a commitment from those of us in paid roles who are undertaking this work, that we are listening and we're doing our greatest to make action come out of these conversations. Particularly ourselves as a women's health organisation in health promotion, we want to learn from you and try and create and build structural change. And I guess I want to say, we're in this together. It looks different, but we share and connect through this experience, and let's be part of something more. I might draw it to a close there unless anyone else would like to make a closing remark.
Just on behalf of ES4W, thank you very much, Emma, for facilitating today. We know that the conversation, the stories that we've heard, Simone, we connected in Tasmania, I believe. And we'll keep the conversation going, and it won't be in vain. And just to let everyone know, the Minister, from the conversation we had with her last week, appears to be on board with everything that we've talked about today. So the idea is that we need to be able to get your voices up through to federal, but also filter them down to state and local levels as well. So Emma, thank you once again for facilitating today. Carly there in the background that's managed that. We've all gone very cool here and effectively. I look forward to the recording. I've been saving the chat notes. So once again, thank you.
Thank you.
Thank you all.
Thank you.
Thank you.
Thank you.
Okay, bye.
Thank you. Bye-bye.
Thanks.
Bye-bye. Thank
Bye.
Thank you. Bye.